A graduate student in Baltimore thinks he could be the first person successfully immunized against COVID-19. David Rock is part of a clinical trial at the University of Maryland. Rock was the first person to be injected with a trial COVID-19 vaccine in early May. Early indications show the vaccine is working by stimulating the growth of antibodies in those vaccinated at rates equal to or higher than in those who've had COVID-19.
It's exciting. It's exciting from the side of a participant. It's exciting from the side of a graduate student who's studying immunology. And it's also exciting that it's hopefully the promise of a vaccine by next year and life returning to a semblance of normal.
Now, he doesn't know for sure if he got the actual vaccine or a saline solution since it is a double-blind trial. But since he had a slight reaction to a second dose, he's convinced he's one of the very few people in the world vaccinated against the coronavirus. He'll be checked again in October and hopes tests will show he has full immunity. Pfizer, the maker of the vaccine, has said if all goes well, it will produce 100 million doses before the end of the year. Hospitals in North Texas may soon be getting help from the military to fight a spike of coronavirus cases in the area. Many hospitals are expanding to surge capacity to treat more patients, but as Fox's Allison Harris tells us, they're still struggling with a shortage of staff.
Hospitals in DFW are now using surge plans. An area ER doctor tells Fox 4 that at one hospital, ICU beds are full, patients are unable to be admitted, and are waiting in the ER for a room. And there are not enough doctors and nurses to work in patient rooms.
Our rank and file physicians and nurses have been in the trenches now relentlessly for 3.5 months. And there is discernible fatigue.
The DFW Hospital Council is preparing to learn Wednesday whether military medical personnel will come to North Texas for support. The Federal Disaster Medical Assistance Team is coordinating. It's a situation that's already happening in San Antonio. The Department of Defense deployed about 50 medical personnel to support doctors there.
The sheer number of patients may outstretch our capacity to effectively and safely care for the patients.
Dr. Mark Casanova is president of the Dallas County Medical Society. He says DFW hospitals probably have enough beds, but having enough healthy physicians able to treat patients is another concern.
A lot of that just depends, again, on the staffing. Sometimes you can have an empty bed, but if our staffing ratios are such that we don't have the nurse or the physician to care for that patient, we need to wait till we have that member ready to serve those patients on the floor.
Hospitals have been moving patients among health systems to try to balance capacity. The ER doctor I've spoken with says they've tried transferring patients to other hospitals, but there's still not enough staff. Casanova says hospitals are also now backfilling support, moving ER doctors into intensive care.
We're going to care for folks and we're going to do it to the best of our abilities, but we're doing it under dire circumstances.
More and more people are wearing masks, but it's tough to do when you're eating or drinking. That's where Shut Your Mouth comes in. The Texas-based company has created a face mask with a zipper over the mouth. That makes it easy to unzip and take a gulp of water or a bite of food. These zippered face masks cost $34.99 and come in a variety of fabrics and colors. They look like they're smiling to me.